Good day, everyone. So today we need to understand one thing. Our heart beats with a rhythm, steady, predictable, and essential to life. But what happens when that rhythm goes out of sync? That's what we call arrhythmia, a condition that many Nigerians are unaware of, yet it poses a significant health risk. Today, we're going to explore what arrhythmia is, its prevalence in Nigeria, the causes, the type, the people that risk, and how to prevent it. This is Seco Direct, and I'm your host, Dr. Tiwa. So what is arrhythmia? Arrhythmia refers to an irregular heartbeat. It happens when the electrical signals that controls the heart's rhythm malfunction, causing the heart to beat too fast. That concept is called tachycardia, or too slow, that's bradycardia, or erratically. While some arrhythmias are harmless, others can lead to serious complications like stroke, heart failure, or sudden cardiac arrest. Moving on to the prevalence of arrhythmia in Nigeria. Arrhythmias are becoming more and more common in Nigeria, partly due to the rising prevalence of risk factors like hypertension, diabetes, and lifestyle changes. Studies show that cardiovascular diseases, including arrhythmias, are now the leading causes of morbidity and mortality in the country. For example, atrial fibrillation, the most common type of arrhythmia, is increasingly being diagnosed in Nigerian hospitals, especially among older adults. According to the World Health Organization, cardiovascular diseases, including arrhythmias, account for nearly 18 million deaths annually, with an increasing burden in sub-Saharan Africa. Studies in Nigerian hospitals show that atrial fibrillation accounts for 30 to 40% of arrhythmias seen in outpatient cardiology clinics. Young adults in Nigeria are not immune to arrhythmias either, especially when linked to conditions like rheumatic heart disease or substance abuse. What are the causes of arrhythmias? Several factors can disrupt the heart's electrical signals and can lead to arrhythmia. First, hypertension, that is high blood pressure. Prolonged high blood pressure can strain the heart and lead to arrhythmias. Secondly, heart disease. Diseases like coronary heart disease or heart failure often cause electrical signal disruptions. Thirdly, electrolyte imbalances. Low level of potassium, low level of magnesium, or low level of calcium in the blood can trigger arrhythmias. We've spoken about this before. Substance abuse. The excessive use of alcohol, smoking, or stimulant use, things like cocaine or over-the-counter medications, can lead to irregular heartbeats. Stress and anxiety is another cause. Chronic stress or panic attacks can lead to temporary arrhythmias. If we move on, we also see things like infections and inflammations. Conditions like rheumatic heart disease, still prevalent in Nigeria, can damage the heart and lead to arrhythmias. Now, let's move on to what are the types of arrhythmias. We have spoken about this. The first and most common type is atrial fibrillation. The heart's upper chambers beat irregularly, increasing the risk of stroke. This is very common among older adults with hypertension or diabetes. Secondly, tachycardia, tachycardic arrhythmias. This is a faster than normal heart rate, can occur in conditions like hyperthyroidism or with stimulant use. Thirdly, we have bradycardic arrhythmias, that is a slower than normal heart rate, often seen in older adults or those with underlying heart issues. Number 4, we have what is called a ventricular fibrillation. This is a life-threatening type of arrhythmia that causes the heart to quiver instead of pumping blood, often linked to sudden cardiac arrest. Number 5, premature heartbeats. Skipped or extra beats, usually harmless, but can indicate a more serious issue in some cases. So who is at risk of arrhythmias? Certain groups of people are more prone to develop arrhythmias. First of all, and most common, is older adults. Age increases the risk of developing arrhythmias like atrial fibrillation. Now, individuals that also have hypertension is or are susceptible for arrhythmia in Nigeria. Diabetes also. Poorly managed blood sugar levels can damage the heart's electrical system. People that also have a family history of arrhythmia, because genetics plays a crucial role in the development of arrhythmias in any body. Smokers and heavy drinkers, lifestyle choices contribute significantly to arrhythmias for individuals. Those with untreated infections, we've already spoken about infections like rheumatic fever or untreated strep throat can cause heart damage. Now, what are the symptoms of arrhythmias? What can we look out for? Now, some arrhythmias can come across as silent, but others have noticeable symptoms. These include palpitations, where your heart feels like it is racing, fluttering, or feels like it is skipping beats. Another symptom that you should look out for is shortness of breath. Difficulty breathing during light activity or at rest can also be a symptom of arrhythmia. Dizziness or fainting. This is caused by reduced blood flow to the brain. That can also be a symptom of arrhythmia. Chest pain or discomfort, particularly in dangerous arrhythmias like ventricular fibrillation, can also be noted. Fatigue, which is unexplained because everybody gets tired. But if you cannot explain why you are tired, even after you've rested adequately, that might also be a symptom. Sweating, excessive sweating without a clear cause. Now, it is important to note that mild arrhythmias may not cause symptoms, but they can be detected by routine tests like ECG. Now, what are the common triggers for arrhythmias? Certain conditions or lifestyle factors can trigger arrhythmias even in healthy individuals. First off, dehydration. Now, dehydration would lead to what is called an electrolyte imbalance, increasing the risk of arrhythmias. Caffeines and energy drinks. High caffeine intake may provoke irregular heartbeats. Sleep apnea. Now, when we say sleep apnea, this is usually very common among overweight individuals because it will disrupt oxygen flow and may lead to arrhythmias like atrial fibrillation. Another trigger that we have to note is fever. A high temperature can increase heart rate, potentially triggering arrhythmias. Overexertion is also another thing we need to take note of because intense physical activity or emotional stress can cause temporary irregular heartbeats. Diagnosis of arrhythmia. Detecting arrhythmias often involves specific diagnostic tools such as what is called an electrocardiogram, ECG or EKG. This measures the electrical activity of the heart. Another diagnostic tool that is used is called the Holter monitor. This is a portable ECG device, one for 24 to 48 hours to capture intermittent arrhythmias. 3. An event monitor, used over weeks to detect arrhythmias that don't occur daily. Another diagnostic tool is called echocardiogram. It uses ultrasound to examine the heart structure and function. Electrophysiological study is also a detailed test where electrodes are placed inside the heart to map electrical activity. Now, what are the complications of untreated arrhythmia? If left untreated, arrhythmias can lead to serious complications, including stroke. Irregular heartbeats like atrial fibrillation can cause blood to pool, that is, collect and form clots, leading to stroke. Heart failure. Now, arrhythmias can weaken the heart's ability, to pump blood efficiently. Now, cardiac arrest is also another complication because certain arrhythmias like ventricular fibrillation can cause the heart to stop suddenly, leading to death if not treated immediately. Reduced quality of life. Persistent symptoms like fatigue or dizziness can affect daily activities and mental health. Now, what are the treatment options for arrhythmias? Treatment depends on the type and severity of arrhythmias and may include, first and of course, medications, anti-arrhythmic drugs to restore normal rhythm, beta blockers or calcium channel blockers to control the heart rate, anticoagulants to reduce stroke risk in atrial fibrillation. Secondly, lifestyle modifications. These are really important. You need to address triggers like caffeine or stress and manage underlying conditions like hypertension or diabetes. Thirdly, medical procedures, especially cardioversion. It uses electrical shocks or medications to restore the normal rhythm. We also have what is called a catheter ablation. Destroys small areas of the heart tissue, causing abnormal signals. A pacemaker is also something that can be used because that's a small device implanted to regulate a slow heartbeat. Now, implantable cardioverter defibrillator, that's an ICD, monitors and corrects life-threatening arrhythmias. And lastly, surgery. In severe cases, surgeries like Maze procedures or heart valve repair may be necessary. Now, these treatments, especially the ones that require surgery, might be pricey, so we need to look into preventive strategies for Nigerians. First off, we need to control blood pressure and diabetes. Regularly monitor your blood pressure and blood sugar levels. Use medications as prescribed and follow a heart-healthy diet. You also need to adopt a healthy lifestyle. Reduce salt and processed foods in your diet. Incorporate local heart-friendly options like vegetables, ugu, okra, fruits like pawpaw, oranges, whole grains like unpolished rice, millet. Exercise regularly. Simple activities like walking or dancing can make a difference. Avoid harmful substances. Quit smoking and limit alcohol consumption. Avoid recreational drugs completely and be cautious with over-the-counter stimulants or herbal remedies that can affect the heart. 4. Manage stress. Practice relaxation techniques like meditation, prayer, or deep breathing. Create time for hobbies or socializing with loved ones to reduce stress levels. Number 5. Seek early treatment for infections. Don't ignore symptoms like sore throat or fever, which could lead to complications like rheumatic heart disease. Ensure timely treatment to prevent long-term heart damage. 6. Routine heart checks. Regular ECGs, that's electrocardiograms, can help detect arrhythmias early. Annual health checkups can identify other risk factors like high cholesterol. So, what are the cultural considerations in Nigeria? First off, there's this thing with Nigerians are relying on herbal remedies, which may interact with these prescribed medications that are normal for arrhythmias and worsen them. Patients should please inform their healthcare providers and their doctors about any herbal treatments that they are using. So, arrhythmias are more common than many Nigerians realize, but they are not a death sentence. By understanding the causes, recognizing the risk, and taking proactive steps, you can protect your heart and live a healthier and fuller life. Your heart sets the rhythm of your life. Let's keep it steady, strong, and in harmony. Stay informed, make healthy choices, and take charge of your well-being. After all, your heart is your wealth. Raising awareness about arrhythmias in Nigeria can save lives. Early detection, lifestyle changes, and timely medical interventions are critical. The more you know about arrhythmias, the better equipped you are to protect yourself and to protect your loved ones. Your heart deserves care and attention. Let's keep it beating strong and steady. And we have come to the end of another episode of the Circle Direct podcast. I remain your host, Dr. Tiwa. If you have anything that you'd like to share with us, please leave it in the comment section below. I'll be able to get through them and get back to you on them. Thank you very much. Until next time, I bid you adieu.